He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Thanks for joining us, folks. It's the Stay Off My Operating Table podcast. If you're looking for something else, you're in the wrong place. Stick around anyway. I think you'll enjoy this. Phil, Dr. Philip Ovadia, tell us about who we're fixing to talk to today.
Sure thing. Another good one this week, Jack. Always good to be back here. Today, we have the honor of having Amanda Decker as our guest, nurse practitioner. And, Amanda and I met at a conference a while back. I had known of her for a while, and we had kind of interacted a little bit on the social media interwebs there. But she's awesome. She's doing awesome work in Tennessee, bringing metabolic health into her clinic. She's been able to introduce it, and we'll talk about this, into the traditional medical system, which I think is great, and really excited to get into that with her. But before we get to that, Amanda, why don't you give a little bit of your background, let the people know kind of what got you into medicine in the first place, and then maybe what got you into metabolic health.
Yeah, thank you. Thank you both for having me. I have been a nurse practitioner for almost 19 years. It'll be 19 years this August. I got into healthcare because it's kind of what I've always wanted to do. If you talk to my parents, they can tell you that from the age of 5, I knew I wanted to go into medicine. At that point, I wanted to be a doctor. That's the only thing I knew. You could be a doctor or a nurse. Those were your only options. And I was like, I'm going to be the doctor. So that was what I was going to be my entire life. That's what I went to school to be. And I met my husband in college. Actually, I met him, and he was my brother's best friend. Met him in my parents' house, but I was in college at the time. And I decided, med school, that's going to take a really long time. That's going to be a lot of years out of my life. I'm not sure I want to do that anymore, but I want to go still into healthcare. I want to help people. I want to help people feel better, improve their lives, that kind of thing. And I had a friend at the time said, well, have you thought about being a nurse practitioner? I said, nurse practitioner, what is that? So I did my research. Wait, I can go work in the clinic, hands-on with people, helping them get better and not go through all that med school stuff. Sign me up. Sign me up. That's how I got to be a nurse practitioner. I went to Vanderbilt University and got a degree there. I'm a family nurse practitioner. That's what I am trained, and that's what I worked in. And I worked as a family nurse practitioner for the first probably 12 to 13 years of my career. And I just kind of got burnt out. And I'm sure you've heard that from many providers, that you're working in the traditional medicine scenario, and it's patient after patient, day after day, hitting the grind, barely having a lot of time to yourself. And at the end of the day, you're just disgusted because nobody gets better. Everybody just got worse. I felt like the only people I was helping get better were the people who had sinus infection and urinary tract infections. Those are the only people I could really help. Everybody else, I was a legalized drug dealer. Here's your next pill. Come see me in 3 months. 3 more months. Here's your next pill. See me in 3 more months. And I just got tired of it. I was about to leave medicine. I was about to step out and go find a different career doing something else. But I said, before I do this, since this is something that has been in my heart that I've always wanted to do since the age of 5, I need to relook at things. And I looked back at my own health journey. And Phil, I had struggled with obesity from the age of 5. When you look back at childhood pictures, at 5 years of age, I was overweight. My siblings were both size 0s. They're skinny bean poles. I was the one of these things doesn't look like the other kind of thing. But I lost weight, throughout my early childhood, teenagehood, early adulthood. It was calories in, calories out, restricting, sometimes almost to the detriment of my health, restricting things. And I'd always gain the weight back. And then somewhere around the age of 30, I thought, if I just do what my grandmother or my great grandmother told me to do and cut out the cakes and the cookies, maybe I can lose weight. I haven't tried that yet. So I cut out cakes and cookies and white things. And lo and behold, I got leaner. And I wasn't quite as hungry as I was. And I maintained that weight for a while. And then I was chatting with the nurse practitioner friend of mine. And she said, you're doing low carb. I was like, no, I am not doing low carb. That is not what this is. All I did was cut out the cookies and cakes and stuff like that. She goes, you really are doing low carb. I said, fine, I'll go look into this and see. So I read several books, read some of Jason Fung's work, read some of Gary Taub's works, which most of us have in this space. And I was like, dang it, I'm doing low carb. And it actually makes sense that I'm getting healthier. And this is why. This is the pathophysiology. This is the reasons why I'm getting healthier. In addition to weight, I also had psoriasis from the age of 5. And at one point, it covered about 80% of my body had plaques on it. And I noticed that.
Okay, I'm not a medical professional, so I've heard the term psoriasis.
Gotcha.
But I don't. 80% of your body had what on it?
Plaques. So psoriasis is an inflammatory condition, and a plaque is like a circular area or area that's raised on the skin that's red and irritated and has crusting over the top of it.
All right.
So it's not, you don't have to have a complete covering it of that area to be a percentage. It's if it's on one part of your arm, that's a percentage that's there. So 80% of my body had some type of plaque on it. Heavy in my scalp, heavy in my lower legs, heavy on my arms. And it did improve while I was getting healthier on this low carb diet. It was the first time that I had seen anything improve my psoriasis other than heavy dose steroid type treatment. Move along further in, back to that time when I was in primary care and getting burnout. I was like, wait, I got healthier through low carb. My body's healing. Why can't I do that for my patients? I can't do that for my patients because it's against the standard of care. It's against what I'm told to do for my patients. So I kind of secretly started sneaking it in. I have little handouts here. And I'm like, I didn't really tell you to do this, but I'm telling you to do this. Why don't you give this a try? Or why don't we just try cutting back on these things? And as my patients started to get a little bit healthier and a little bit healthier, I can't not tell people openly to eat this way. If it's changing me and I'm seeing it change people when I'm enacting it in a small way, it's wrong of me to not do this on a bigger scale. Sure. That to me was like, that would be against the Hippocratic Oath. It would be against medicine for me not to give that to them. But I also felt inadequate to give them that information. Yes, I had a nurse practitioner degree. Yes, I had all these years of experience behind me, but I didn't feel like I had the credentials that I needed to back this up. Yeah, I'd read some books too, but it needed to be more than that. So I went back and got some certifications, and I kind of have this alphabet soup thing going behind my name right now. So I went to the Obesity Medicine Association and got a certification through them as a advanced practice provider. I was approved through the SMHP as a metabolic health practitioner. I was the first female to achieve the metabolic health practitioner certification behind my name. I also went to the American Nutrition Association, and I'm a certified ketogenic nutrition specialist. I have a couple other smaller things, but those are my big credentials that are behind me. And armed with that, I said, okay, I am now ready and credentialed to give this information to my patients and say, I really know what I'm talking about. And so I changed the practice focus, not just from primary care. I didn't drop my primary care people and tell them to go find somebody else. I kept seeing them, but I started a medical weight management program where the basis of that program is lifestyle, teaching people how to change what they eat, to change how they move, change how they address their stress levels, change their sleep habits. We call them the 4 pillars of health at my clinic, and to truly transform their lives. Now, we will offer medications if they want that for weight loss, but everyone that comes in gets a heavy dose of education and is supported through my team to make lifestyle changes, because without it, it doesn't matter what you do. You're not going to be successful. You got to change your life. Long story short, Phil, I got into healthcare because that's what I've always wanted to do. It's always been my drive. I got into metabolic health because I made myself healthier and I was burnt out in practice. And I took the two of those and went with metabolic health because it reignited my passion for medicine to help people feel better and to truly see their lives changed.
We could almost just stop right there. Just
it's an amazing episode already. Let's dig in a little bit more.
Yeah.
So, one of the criticisms that oftentimes gets levied against, low carb, and maybe this is true of lifestyle change in general, is that people won't follow it. It's only the privileged few that can do it. And I think one of the reasons that it doesn't get more widely accepted in mainstream medicine is just the general concept of people just won't do it, so why should I bother trying to teach them this. So here you are, you're in a clinic, you're in the middle of Tennessee. I don't think you have what would be considered a very privileged clientele, and yet you're doing it. Talk about how well it works, how open people are to this, and what the experience has been around it.
Yeah, so I'm about an hour west of Nashville. It's semi-rural. So I have some patients who are extremely rural that live an hour, 2 hours away from any type of city without a lot of healthcare around them. And then I have people that are coming from Nashville and Franklin. So I've really got a mixture of patient population here. Through my clinic time and with helping people get healthier, at first I thought nobody would do this, that nobody's going to want to do this. And then I thought some people can't do this because of their means, they're what they can afford. I learned pretty quickly that I should stop assuming things for other people. You don't know what someone's going to do until you give them the option to do it. And at the end of the day, it's more costly to get sick and have diabetes and be disabled and to have all these health conditions than it is to change what you're eating. And most of the time, it just takes time. It takes someone sitting down and showing concern and care for investing in their life. When I walk into my first healthcare consult for an obesity visit, my first question has nothing to do with their health. My first question is, tell me about you. Tell me about who's in your household. Tell me about your lifestyle. Tell me about the things that make you happy, the things that bring you joy, because I want to know about you. I care about you. And all these things actually feed into your journey. If you don't have ways to relieve your stress, if you don't have good family support, I need to know that because it's going to affect your journey. So one, you have to invest. It takes somebody investing time. And then someone who's going to start thinking outside the box. If someone comes in and they don't have great financial means, I'm not going to be suggesting that they go buy the best cut of steak that's out there. Ribeye is not going to be on their menu every night as much as they want it to be. But we can still make a plan that's healthier whole foods. We can include things like canned anchovies and tuna. We can look at boiled eggs. We can, look at different things that are on sale that week. And I shop in the same stores that they do. So I can tell them what's on sale because half the time I'm buying that stuff too. I got kids. They eat a lot of food. Some people are not there. You have to assess the patient. And if they are not ready to make changes, then you have to meet them where they are and say, what are you willing? If we're not willing to rip the Band-Aid off and go cold turkey and change everything about what's one thing we can change, and then build on that change. And other people are ready to make the complete change. They just need the tools to do it. They need to understand the why they're doing it, and then they need help figuring it out. And that's what we do here at our clinic. That's why we have health coaches that are posting recipes and calling patients and giving them information. That's why they're having frequent contact with me. When they walk in my clinic, there's a book full of recipes that they can pull from and look from. It's just about that connection and giving them the tools. And I feel like anyone can make the changes if they're given the right tools and they have the right motivation to do it. And it's really wrong of us to assume that they can't. It's very judgmental.
It's wrong of us to assume they can't make the change. So we've talked to enough healthcare providers, and Phil lives with it in his profession, to know that attitude that people aren't going to do that is pretty common. So I want to kind of put a pin in that particular issue, healthcare providers not bothering with it because they prejudge people not going to do it, and go back to a comment you made about you found it morally objectionable not to tell people about this. And yet there's something in the requirements of your profession that kept you from doing it. I'm a non-professional, remember. I'm just a guy who goes to see a healthcare provider. I don't know what you're talking about. Why couldn't you tell me about this? What is it that prevented you from telling me about this?
So we kind of have this standard of care. The standard of care is what we're expected to deliver to patients day in and day out. For example, if they come in with high blood pressure, you're supposed to tell them to eat a low salt diet and that they're to go on a particular medication and they should probably exercise. Those are standard of care type things. The standard of care here in America is a very low fat diet, which in turn turns into a high carbohydrate diet because you're supplementing the fat with something. And, that's a whole different rabbit hole that you've probably already went down multiple times with other providers of how we got to there. But the standard of care is a low fat diet that I'm obligated to tell people to do that standard of care. And if I don't, I'm going against that. And it can set me up for liability and things down the road.
All right. I guess I've never actually asked anybody this question that directly, but what I hear you saying is that there is some sort of professional pressure, and it sounds like a threat if you don't tell people who present with a particular problem. What did you say? High blood pressure? If you don't tell people these things, which there is a overwhelming mountain of evidence tells us is the wrong thing to tell them. But if you don't tell them that, you're risking censure or even
You're
losing your
risking,
license.
if there's negative outcomes, you're risking malpractice. You're risking scrutiny from the people that employ you, the places that employ you, your licensing boards. All of that can come under scrutiny.
So you if you tell them, yeah, go ahead and reduce your salt, go to a low fat, high carb diet, and exercise a little, and they get rid of the fats, eat a lot of carbs, may or may not pay attention to their salt, and go for a walk twice a week after dinner and fall over and have a heart attack, you're free and clear.
Absolutely.
Yeah, it's
Kind of mind blowing.
Yeah, it is kind of mind blowing that it's not. And if you do the opposite and you get great outcomes, you can still, as Amanda said, come under the attention of, forces that you don't want to be under the attention from, whether it's your employer, your healthcare system, whether it's a licensing board. And unfortunately, we've seen some examples of this. We have practitioners who have gotten in trouble for doing this type of stuff. Now, to my knowledge, all of the ones that it has gotten to that level, they've all been exonerated because there is a lot of evidence for what we're talking about, and it does get good outcomes. But that's the environment, unfortunately, that medical practitioners are under these days. Independent thinking is thoroughly discouraged in medicine these days. That can apply to lots of things, but it is what it is.
It is. And it even goes further into insurance because I'm an insurance-based practice where I'm at. And so if I have a client who has diabetes, I'm required to check their A1C every 3 months, which that's, understandable, but I'm also required to put them on a statin. I'm required to give them metformin or another drug, and follow down these lines of things, even if I don't feel like that is the best option for them. I'm required to give that to them. And if I don't, the insurers look at, did I meet these metrics? And if I didn't meet those metrics, then my score goes down. And eventually your scores stay down long enough, your reimbursements go down. It's hard to stay in practice if your reimbursements don't stay up. So you're incentivized to give more medications to patients and counsel in certain ways because of insurance companies. I don't get incentivized for
let me
getting
make sure.
off meds, so that's the odd thing.
Let me make sure I understand what you just said.
Yeah.
You are incentivized to prescribe drugs.
Yes.
And if you, and granted, I'm totally ignorant about all of this, but I wanting to understand. So somebody comes in, and if you can put them on 3 different drugs, all of which fit inside this wackadoodle standard of care, and they don't get well, but they keep reordering their drugs, you get a nice high score from your insurance company, and they make sure you get lots of money.
I get my reimbursement rates don't go down. I don't get penalized. I guess I should say the incentive is that my reimbursement rates don't get reduced, not that
and reimburse. I realize we're talking business and not medicine here, but I'm wanting to understand the business of medicine. So when you say your reimbursement rates, does that mean they ordinarily we give you 85%, but now you're only going to get 80 or something like that? Is that what it is?
Yes, they can reduce your contracted rates. Every employer has a contracted rate with individual insurance companies, or each business has a contracted rate for services. So like a level 3 office visit has a certain dollar amount that's associated with it, and then you get a percentage of that.
Now, if this exact same patient who keeps re-upping their prescription and not getting well starts doing something different, eliminates their insulin resistance, starts dropping the way their internal inflammation goes down, and their need for all these drugs begins to drop or even just go away completely, do you get any credit for that at all? I mean, is there anybody who says, yay, you're a good doctor?
The patient does, but no, the insurance companies, no. And in fact, when you look at my star ratings, where it used to be a level 4, slowly as I'm helping people get healthier, they get less. So now I'm like a 3.5 or 3 because my patient doesn't need that drug anymore. So I take them off of it, but the diagnosis is still there. That doesn't go away. Once the diagnosis is there, it's there. So yeah.
Comment, please, Phil. I realize this is not news to you. And I realize we've probably heard it before, but it's all the penny is dropping here for me.
Yeah. It's really kind of baffling when you sit back and you look at the system. And this is a large part of why we're in the situation that we're in, and people ask, why don't doctors just change what they do? Because it seems so glaringly obvious, how to solve these problems. And this is a lot of the reason that it doesn't happen, is because the system is set up in such a way to discourage this from happening. And, the system isn't really geared towards the patient outcomes. Ultimately, it's geared towards doing things for patients, which usually means prescribing medications or doing procedures, is really what our medical system is centered on. So when people wonder, because the people that listen to this podcast, let's say, and now here we are, they've heard 150 episodes of, doctors and other practitioners and everyone talking about this. There is a simple solution to all of our problems. And they wonder, why hasn't it happened yet? I guess today we're getting into a little bit of why hasn't it happened.
Yeah, because our system is definitely a sick care system. It's not a wellness system. It's not there to make people well. It's there to manage illnesses. And notice I said manage, not improve.
But, the good news, the bright spot is that some people, Amanda, figure out ways to make it work within the system and figure out maybe a little bit of how to work around the system.
Absolutely.
And still make it work. You mentioned that your practice has largely shifted towards obesity management, weight management. A lot of that these days, of course, is drug centric. And I'd like to hear a little bit, since you're, kind of in the trenches as it is, how you've approached that kind of, I'm sure you have patients coming to you saying, I heard the best way to lose weight is to go on medications. So how do you approach that? And, do you use the medications at all? How do they kind of fit into your overall philosophy?
Absolutely. Yes, we do prescribe and offer medications to patients because I believe ultimately it's the patient's choice. It is their journey. It's not my journey. It's my job to give them the information. When patients come in, a lot of them are coming for just the prescription. But me being me, they start with an hour-long consult with me. So each new patient, it's an hour-long consult, getting a full history, obesity history, psychosocial history, that type thing. They do some tests.
What does psychosocial mean in your context?
Their family support, their financial stability. Do they have any mental health illnesses that are confounding our journey or that might change our journey, that type thing?
You're finding out what's going on in their life.
Yeah, so you want to get the complete picture of the individual. They are given nutritional information on the macronutrients and how macronutrients affect their body and how important it is to change your lifestyle, and how if you don't rest well and don't get good quality sleep, how that affects your ability to burn fat in your body, how stress affects the ability to burn fat in your body, how exercise can improve things, but you can't outrun the bad diet because you can exercise and then out eat it in about 5 minutes after your exercise and outdo it.
Is this news? Is this news to people?
Some people, yes. Some people have no idea, especially when I sit down with a food label, and my food label example is oatmeal. Something we've been told for years that is a very heart healthy food and that we should all eat this to lose weight and make our heart healthy. So I use just old fashioned oats, the kind you cook on the oven, not the kind that you put in the microwave that already has the sweetener to it. And we look at it and I say, I need you to look at the serving size, and then I want you to see how much protein is in something, and then go to the total carbohydrate. And I give them a protein goal that I want them to hit. So I'm like, your bowl of oatmeal has maybe 5 grams of plant-based protein. Plant-based protein is not as absorbable as animal-based protein. So you're only getting a couple of milligrams or grams of that protein. Then when we look at the carbohydrates, that all turns to sugar. So a bowl of oats turns to 5.5 teaspoons of sugar. And that's before you put the teaspoons of sugar in it to make it taste worth eating. So this is just a whole bunch of sugar. And then I have some other examples on the side. I'm like, that banana that you love to eat every morning and you think it's doing you amazing things. Well, a small organic banana is 30 carbs. Well, that's 6 teaspoons of sugar and next to no protein in that banana. So your blood sugar's doing this all day long and your insulin level's doing this all day long. And as long as your insulin's up, you can't burn body fat. If I don't control that, I'm not going to control your weight loss. So that part is shocking to them. People don't realize how much sugar they're truly eating, even if they're eating what they consider to be a healthy, more whole foods type approach of diet. That is, that part is very shocking to them.
Is that more people than, is that a small percentage, a majority? I mean,
I'm going to say at least 80% of people have no idea how their body metabolizes macronutrients. And the other 20% that come in have probably already been following me or Dr. Berry or Dr. Ovadia or someone on social media, and they already know about it. And they're just needing more help. They're needing reassurance and want somebody to kind of take them along and help them further along their journey.
So you're doing a lot of education.
I do a lot of education. Yes. And then at the very end of all of this education time, I said, all right, we're a medical weight loss clinic. I'm going to talk to you about meds, and I'm going to tell you about all the pros and cons that are related to them. And the first one is drug side effects. They all have side effects, and you have to decide if you're willing to risk those side effects and see how severe those side effects are. You also have to think about the cost. And you have to consider that most drugs used for weight loss are lifelong drugs. So if you're not into adding another drug for the rest of your life, then we need to table this conversation for another time. And then if they are interested in medication and they are interested in a specific medicine, we'll talk about the side effects and the risk and the benefits of that particular one if they decide to use it. We do offer drugs. I'm very clear with them from the very beginning that you still have to change your life. And while medications can be a tool in weight loss, they're not the answer. And specifically the GLP-1 class, the injectable ones that have been used for diabetes, that are the hot commodity in the entire world these days. It is meant to be lifelong. It is extremely hard to come off of. If you stop it, most people gain their weight back very rapidly within 3 to 6 months because of the hunger that comes in and hits them afterwards. It does have a lot of side effects and a lot of risks that I don't think that we fully know and understand yet. If they still decide, that is their patient choice, they're free, they have free will to decide what they want. I'm just here to help them in their journey.
What I was just going to ask, following up on, you were kind of talking about patient types, but what do you find more challenging? So the patient that comes to you and they've just been basically not following any advice, just eating junk food and just know they need to make a change, versus the patient, like you were describing, who thinks they've been eating healthy. They've been following the advice. They've been eating their, 6 to 11 servings of whole grains a day and their fruits and vegetables like they've been told. Which one do you find to be these days more of a challenge to now say, low carb is the way to go?
Yeah, probably the people who think they're doing everything right and have tried everything. Because a lot of times then I'm having to really convince them that they feel like they've tried everything, but they really haven't tried everything. And what they thought they were doing, they're not quite doing. But that particular patient is more times than not coming in specifically looking for the medication. And so I'm having to convince some buy-in. I got to buy into this lifestyle because they came in with the intention of medication.
Look back on your own story. Look back on that moment where you said, maybe I'll do what my grandmother suggested. And then think about your clients who've taken your guidance. Is there a common factor? Do people just and Phil, I mean, you had a moment like that too. What is it that's missing when people get all the information and still do nothing with it?
Yeah. And Phil, you may find this too, but I think a lot of it is two things. One is hope. I think somewhere along the journey, people give up and they feel like they've really tried everything. They feel like they've exhausted everything. They may not have the great support to help them make changes. And every time they've lost weight, they gained it all back. And so at some point, they lose hope. And you've got to give them back that hope and let them know that it is possible. So I think that's one. And then the other is food addiction and how powerful food addiction truly is, and trying to convince people that you cannot moderate certain foods, even certain foods that you may think are very healthy, that if you are a food addict and your drug of choice is sugar or carbs that turn to sugar, just trying to eat less of them is only going to end up back in heartache and back on that hamster wheel that puts you back where you were starting. Hope and food addiction are probably the two things there that are different. And they're probably some of my most difficult things to address in clinic too.
Phil, did you have a similar experience?
Yeah, I was really going to say about, you got to get the person who hasn't given up yet. They're still kind of desperate. They want to address the problem, but they haven't given up yet because, unfortunately, a lot of people, just have given up. I mean, they like you said, they've tried what they think is everything, and it hasn't worked. And they're like, why am I going to try yet another thing that doesn't work? But hopefully you can convince them. And, again, I think that's where your personal story helps. That's where, being able to point to all the success that your patients are getting, and hopefully you can still give them the hope that they need and, give this a try. So that certainly has been my experience as well. Talk a little bit about, implementing this in your life, in your experience around, you're a busy professional, you're a mom, and a wife, and, how it works with your family. And, again, a lot of people look at a life like you live and like I live and say, it was just too busy to do this. So talk a little bit about how it's worked for you personally.
So when I first started out, I was the only one in my household eating this way. And so how we made it work is we had a meat and veggie and everybody else had a starch with it. We just I didn't eat certain things and I had to use a lot of internal gumption to not eat the starches at times when I wanted to. And then slowly over time, my family joined with me. So my husband came on board and he felt amazing. Then I slowly convinced my parents to eat this way after many times of having to turn down their lovely desserts that they were putting in my face. And they're like, "You're really serious about this stuff." I'm like, "Yes, I am. It's making me healthier. It can make you healthier too." So then they came on board, and even my little beanpole sister came on board. She uses it to treat her. I shouldn't call her beanpole. If she's watching, I'm sorry, Danny. I really do love you. But she's one of those people that's always been a size 0, except for when she was pregnant. But she had migraine headaches and IBS. And so she used this way of life to treat that. And my brother came along too. And so it's just kind of slowly weaved out into my family. But at first it was extremely difficult, and it was a little bit more expensive because I was doing my food and I was doing their food, and just over time, slowly and persistently converting. My son was about 8 when we started trying to get him to eat more low carb. That was a struggle. It really was, because when your kid reaches the age of 8, they've already got their food preferences kind of set. And I did it to myself. I wish I'd never given him the first Cheeto, I'd never given him the first Dorito, never given him the first cookie. It would have been so much easier. But I got his buy-in by saying, I set him down in front of Diet Doctor website. I said, "Pick me some recipes that you want mommy to make for you, and let's do that." And so he picked a slew of different recipes. He helped me make them, and he tried every single one of them because he picked them. So I used a little bit of reverse psychology there with him. And then slowly it was, all right, I'm not going to buy this candy anymore. We're going to buy blueberries this time, or we're not buying this treat. We're going to have some special pecans this time that we haven't had in the house. And so it's slowly trading out and making changes. My kids still have a little bit more carb than my husband and I do. They're young, they're healthy, they can tolerate those. We still try to stick to mostly whole foods, but they have more fruits than my husband and I do. And then they have some like gummies that are made out of fruits, because I'm not making everything from scratch like Maria Emmerich does. There's no way I can do that. Aldi's has a great selection of no sugar added, dye-free type stuff. And so that's where they get their gummies from. And kids like to eat things from packages. I don't know what it is about packages, but they just think that they are.
Wait, whoa.
I know.
Kids liked, oh my God, I hadn't ever thought of that. Phil, we got to jump on this, buddy.
Steak in a package? Is that what you're thinking?
Steak in a package. Oh my Lord.
Yeah. Now, when kids go to school, they have plenty of opportunity to eat things, but I try to control the stuff in my house. I can't control everything. I try to control the stuff in my house. I've learned that I have to grocery shop 1 week at a time, because fresh food goes bad sooner. Mm-hmm. So you only buy the foods that you can eat in this week. And I have my standard grocery shopping time that I go before. When I work 4 days a week now, I was working 5 days a week at one time. I had to do click list and pick up type things then. But now that I'm 4 days a week, I go every Friday and I pick up the food for the next week. Which click list is an amazing tool for people that struggle with food addiction, because then you can go in and you can pick your foods and someone else does the shopping for you, and you're not tempted to buy the other things that you don't see. So if you use Instacart or ClickList or whatever, that's a great tidbit that's there. Let me see, how else did I institute it in my family? My daughter, she's 9. She is 100% on board with eating low carb and low sugar. But unfortunately, it's because she got the IBS side of things that my brother and sister had. And grain, she's very gluten intolerant, but she can read a food label and tell you exactly what should be on there. She's into cooking and making things differently. I've been posting more pictures with her lately, doing her own cooking. It was arming her with the knowledge. And once she knew how to read the label and search for certain words, she took it and ran with it. And yeah, so I may have gotten off track there. I'm not sure what else you want to know about, personal. How did I implement it in my family? But it's day in and day
You
out.
actually just gave some really good information.
Yeah.
What
I do.
I think of a number of things. ClickList, for example, which I
Uh-huh.
hadn't heard of before. Instacart, yes, but I hadn't heard of ClickList and how that can help with the food addiction thing.
Mm-hmm.
And frankly, to me, that's a tool. Hey, if you're struggling every time you go down a grocery store aisle, here's how to get what you need without going down the grocery store aisle.
Mm-hmm.
Okay, that's hope. And
Mm-hmm.
then it's really cool to consider the possibility of the 9-year-old.
Mm-hmm.
This is not rocket science or rocket surgery in Phil's case. This is a 9-year-old can do this. And
Mm-hmm.
granted, she's probably a precocious 9-year-old, but still, and I would think that would give people hope. Yeah, I'm looking for all these little things that it's bad enough that our bodies love the stuff that isn't good for us,
Mm-hmm.
and we got to deal with that. But I guess it hadn't ever quite hit me to what extent the entire system was actually arrayed against us. So anything that can give people that hope.
Mm-hmm.
I guess that's what I was looking for. What is it? What happened? Is there some kind of lever? And I hadn't thought about it being something like hope,
Mm-hmm.
but anything I think that can just a little drop of hope in the murky water of trying to get and stay healthy is going to
Yeah.
help people. So I'm grateful for that.
Absolutely. We've had a couple of patients or clients here that they work at McDonald's. That's their job. They're McDonald's servers. And when you work at McDonald's, you get to eat the food at McDonald's for free.
Yeah.
Like it's just given to you. And they're not the highest on the wage earner type scale. So our complete plans have been around how to eat low carb at McDonald's. And that's
Which is
something I
cool.
guess we had to implement in our household too, is when we did eat out, we don't eat out much anymore because honestly, it's more expensive and you don't know what all is in your food. But in the beginning, it's when I go to this restaurant, what can I eat? What can I order? Instead of just always ordering the thing that I've always ordered. And when they sit down, it's almost like a panic sets in. I don't know what to do. All those foods that Amanda told me to eat, I just can't think of a single one of them. So instead, like our app that we have has all the chain restaurants in it. So you go here, this is what you order. Don't even open the menu, or go look at the menu ahead of time when no one else is staring you down and waiting for your order, so that you can make a good choice and write it down and tell the waiter what you want, or have someone else order for you so that you're not having to stay strong and make that decision in that moment. But really and truly, a lot of times that hope is just figuring out, all right, how do you eat McDonald's? How do you eat Burger King? How do you eat Taco Bell and still stay on track during all this? How are you a over-the-road truck driver, and what do you pack in your cooler? Because what you've always packed is not what you can still have.
Do you have a favorite patient story?
I got lots of patient stories. So I have several favorites. Now, one of mine, and it is actually one that I have used medication with, but this gentleman, and I've talked about him on previous podcasts, he was about 300 pounds overweight when he came to see me. And when he walked through the door, there's no steps, no incline to go up, but he had to stop twice from the lobby to the exam room to catch his breath because his congestive heart failure was so bad that he could barely breathe. Broke a sweat just getting to the exam room. He was on 4 different diuretics. So diuretic is things that pull fluid out of your body because heart failure makes you retain more fluid and you essentially feel like you're smothering. So he couldn't breathe on 4 diuretics. He had no hope when he came into the clinic. This man was already diabetic. His heart doctor said, "You're dying. You're going to die soon. You have to change something." And he's like, I don't know what to do. So we sat down, we went through our first whole hour of education, and the look he had at me, I walked out of the room and I looked at my girls and I said, he's not going to do anything. I just told him. I was like, he's not coming back. He's not going to do anything. I just told him. I didn't have hope for him at that point. And I've talked to him about this since, after that visit. I see my patients back about 2.5 to 3 weeks after that first consult, just for a telehealth kind of check in. How are you doing? How are you adjusting? Are you taking your electrolytes? Are you hitting your protein goals? Things like that. And he was in tears on the other end, which put me in tears on the other end, because he said, "Amanda, I can breathe." He lost 20 pounds in 2.5 weeks. And he said, "For the first time in a long time, I can breathe." Because I feel like my life actually might be saved.
Wow.
Okay, evidently something I said stuck, so let's keep going. I think he's lost maybe 150 pounds total to this point. He does struggle still. He has some food addiction issues. We've identified that he cannot go to an all you can eat buffet because there's too many temptations there. So we just don't even go to restaurants like that. Doesn't have a lot of support at home. So we're his main support, encouraging him to keep going. And like I said, he does have that medicine on board, but he's gotten down to having one fluid pill as needed. And the as needed is only when he goes to the buffet. But every time he comes in, we're through different struggles. I need you to remember, man, I didn't know that you were going to do this, and you couldn't breathe and thought you were going to die. And 2 weeks in, you were saying, I might actually live. And now we're 2 years later, and you can do most everything that you want to do and breathe and reduce your medicines. And so I don't know if we're going to get all the way to our goal, but we've gotten somewhere. And we've added years to his life, and we've added quality to his life. And that's important to me. So my other favorite story. Yeah, I gotta get my other favorite story. It's another guy, and it's not favorite for the amount of weight that he's lost, but this guy's a vet. He's a veterinarian. He actually takes care of large animals. He takes care of my dad's cattle, to be honest. But he came in and needed to lose weight. And I was like, oh, this is going to be fun. This is going to be a fun consult, because he's got a lot of this knowledge, this pathophysiology in his head, this how does the body work? How does metabolism work? Because he's a vet. And he listens to my story and he says, I don't know about this. Really? How do you not know about this? He says, that's just not what we're told to eat. And I looked at him and I said, dude, you're a vet. When your animals get sick, when your dogs are getting diabetes, what do? And he just looked at me and he said, curse words. Ah, man, you're right. I put them on protein. I'm like, yeah, I put them on protein. And it's when you want to give advice to your farmers to fatten their pigs, what do? He said, I feed them corn and molasses and grain. I said, okay, so what are we going to do? We're going to eat meat. Okay. So completely different stories. They both are being very successful. But yeah, those are two of my favorites.
I'm digging those stories too.
Great stories. And, with the, when we talk about, and I know you kind of we didn't even get into this, but I know you have some family background in farming and ranching and taking care of animals. And you just, again, this is obvious. This is stuff that we've known going back generations. And yet somehow here we are struggling to get people to understand it again. Yeah. And that's really what it's all about. Getting people to learn what they already knew is really the challenge that we face today.
Mm-hmm. Yeah, we've gotten into this cycle of thinking that everything's genetic. I'm diabetic because I'm genetic. I have heart disease because it's genetic. I have high blood pressure because it's genetic. I have rheumatoid arthritis because it's genetic, whatnot. And it just baffles me, because even when I started practice, 19 years ago, these conditions were not at the amounts that they are today. And let alone when you look 200 years ago, and our genes just don't change that quickly. So something else has changed to trigger it. These things, they may have genetic tendencies, but they're not genetic conditions. But it's almost like a learned helplessness that's been put into our society of, oh, there's nothing you can do about this. You got it from your genes, which I don't know if you've read Michelle Hearn's children's book that has been out. My daughter and I did a podcast on that one a couple of weeks ago. We were out and Willow did a review of the book. And Willow got to the part, she was reading the part where the fox got fox 2 diabetes, type 2 diabetes, and the doctor comes in and says, oh, it's your genetic. Then you just keep eating these foods. The dietitian will tell you how much of these foods you can eat and we'll give you this medicine. And Willow stopped mid-book and she goes, why, Mama? Why would they tell him that? That makes no sense. His grandpa doesn't have fox 2 diabetes, and these foods that he's eating is giving him fox 2 diabetes. So why in the world won't they just tell him to eat less of that food? I know, baby. I feel your pain. I feel it.
Oh my gosh. All right,
So it's
folks.
like it's obvious. It's obvious, but yet it's not.
So we are part of the revolution here.
Trying to be.
It's wow. I'm slow to pick these things up, but if I hear it enough times, it eventually gets into my noggin. So before we started recording, you mentioned that there's a conference that you have organized and host, and I think you said you're in year 3 or 4 on this.
Yes, this is our
what's the dealio?
3rd year. So about 4 years ago now, and I was at Low Carb Boca with Dr. Ken Berry, and Ken lives about an hour from me. We were having a conversation, and I said, Ken, we got to do an event. We got to do an event to our hometown because I'm doing a great job here in my clinic. I'm reaching one patient at a time, but there's only so many people I can see in a day. We need something bigger. We need something to get the word out and to let anybody who comes, because it's a 3-month wait, 4-month wait to get in to see me. I was wondering when you were going to do that. I was wondering when you were going to ask me. So we partnered up and we created an event called Low Carb for Better Health. It is open to anyone and is designed for anyone who's interested in using a low carb approach to better their health in any way, shape, form, or fashion. The very first year we held it in a high school auditorium. My husband's a high school teacher, so we held it in his auditorium. Tickets were $10. And I said, all right, if I get 50 people here, it's going to be amazing. We sold 178 tickets. COVID hit the week of that, so we only had about 134 show up, but it's like, for the first year, this is pretty amazing. But we got to go bigger. We need to do more. So I moved to a local venue. It's in a beautiful state park here in Tennessee, Montgomery Bell State Park. And last year we had year 2 of the event. It's a great time. We had around 300 people attend in person and had about 40 people on a virtual format that were attending. Craig Emmerich spoke, Dr. Eric Westman spoke, Ken spoke, Nisha spoke. We had a diabetes specialist. It was a great time, had great feedback. And so I was bold enough to go for year 3. Year 3 is going to be a little bit even bigger and better than last year. We're hoping for an attendance around 325 people. Dr. Ken Berry and his wife will both be back with us. I'm not speaking, I'm just the host. So I'm the DJ, so to say. I'm the happy face that bounces around and keeps everybody interested. We have Dr. Christopher Palmer coming, who does
excellent
psychiatric type things. We have Dr. Mark Cucuzella, which is his story and the things he's done in his career is pretty amazing to me. Talk about somebody trying to buck the system and implement low carb. That was, exactly what he did. We've got Zane Griggs, who is a personal trainer. I wrote a book with Dr. Ken Berry. I won't say the name of it because it has curse words in it, but it's something about being fit after the age of 50. Amy Berger is coming. So Amy's been in this space for a long time, has a lot of good information about hope in general and keeping going. And then Tia Reed will be there. Tia Reed is another person from the Society of Metabolic Health Practitioners, and she's a health coach with Dr. Tro Kalasian. And Roxanne Stobier, I don't know if I'm saying her name right. I've got to ask her exactly how to say her name. She's also with the SMHP, and they're going to do a co-presentation together. Our theme this year is called Never Give Up. So all the talks are going to be centering around not giving up and changing your life. Yeah, it's going to be a great time. If anyone is interested in coming, the website is LC, the number 4BH.com. So that stands for low carb for better health. And you can click to get tickets there. It's a 2-day event. Friday is going to be a nice VIP dinner, sit down, open question and answer with the speaker panel, mingling with other people. And then Saturday we'll have a more formal talk schedule where each speaker will be given about an hour to speak. So it's a great time. I can't wait. And Montgomeryville is beautiful. It's like a resort there. So talk about stress relieving, just getting out in nature and connecting with other people. You know, when we go to conferences, when I've been to conferences, I come back with nuggets to use in my own life, but also just feeling rejuvenated of, hey, we're in this together and I've got other people to do this with me. And it's a very uplifting experience. And I hope this year will be too.
Who's the target audience?
General public, but anybody. Last year, we actually had several healthcare providers who were interested in getting more into low carb. Like we had one, she was a GYN fellow in Nashville, and she just heard of the event and came to learn more about it. And it's like, I got to do this. I got to do this. It's, yes, you do. How can I help? So it's open to anyone. It's more, I would say the talks are geared more for the everyday person, not the healthcare provider. So there's no continuing medical education that goes along with this. But we get into the studies because what I find is everybody wants to know that. They want to know that what we're telling them is backed up by literature, is backed up by knowledge, and is not just us shooting the breeze out there.
Yeah.
Anyone can benefit from it, but it is geared towards general population.
Very good. So that is low carbs for
low
better
carb
health.
for
Low
better
carb
health.
for better health.
And the website is lc4bh.com.
lc4bh.com. Mm-hmm. That's pretty. I'll bet there wasn't anybody else who was trying to get a hold of that particular 5-character sequence of letters for a website.
No, it works well for hashtags and all that. Yeah.
Congratulations. Congratulations.
Good branding. Awesome. And then for people who want to get in touch with you, follow you in general, tell them how they do that.
I am on Instagram, Twitter, Facebook, and LinkedIn, all under Decker Less Carbs. So my last name, Decker, Less Carbs.
Very good. Phil, it's funny how this stuff, I can hear this stuff over and over again, and then something happens and I finally get it. And today was one of those days. I don't think I'd really quite grasped what a serious catch-22 you guys are in. And, I salute both of you for hanging in there and continuing to have the health of your patients as your primary concern. And on behalf of the patient population, thanks. We appreciate it. It's good to have folks like you out there.
Thank you.
Turning on the light where things are kind of dark. Any last words, Phil?
Just love what Amanda's been doing, and it really inspired me to see everything she's been doing, and honored to get to know her and chat with her on an occasional basis. And it was great finally having you on the show.
Thank you. Thank you for having me.
It's good to have you here. All right. For Amanda Decker and Dr. Philip Ovadia, this has been the Stay Off My Operating Table podcast. All the contact information for Amanda will be available in the show notes. So go there if you want to find any more information. Thanks for listening. We'll talk to you next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.